Hi, welcome to another episode of Healing Space. I am your host, Cara. This episode is very close to my heart. If you have hidradenitis suppurativa, secrecy tends to be a part of our journey. Sometimes the secret's for one reason or another, and honestly, oftentimes it's many reasons all at once. For some of us, HS is even a secret from ourselves. We didn't know that we had it for years. We brushed off symptoms. We misdiagnosed ourselves or were misdiagnosed by professionals. That was me. Almost a full decade of knowing something was wrong, but not knowing what it was. And then, even after I got the correct diagnosis, HS remained a secret for another decade. Not because the disease was gone, but because I was ashamed and embarrassed to talk about it. Before we dig deeper, I want to say thank you to UCB. It's not a secret that they support us and this podcast and the HS community as a whole. Thank you, UCB. Okay, why so many of us keep HS a secret? Keeping a diagnosis private is more common than we think. A 2022 study in the Journal of Dermatology found that over 60% of HS patients avoid telling friends or coworkers about their condition. The reason most of them reported? Shame and embarrassment, based upon symptoms and location. A 2020 French survey of 1,700 HS patients reported that nearly half had not told their romantic partner about their disease during the first months of dating. Multiple reviews show that secrecy and chronic illnesses as a whole often come from fear of stigma, fear of being misunderstood, fear of being seen differently, fear of burdening others, and believing our struggles make us weak. Holding a diagnosis in secrecy doesn't mean you are being dramatic or exaggerating. It means you've been trying to protect yourself. The problem with secrecy is when we keep HS a secret, we often think we're doing it to stay strong. If we don't talk about it, I don't have to feel it. If I don't tell them, they can't judge me. If they don't know, I don't have to explain. But the shame and embarrassment always tries to isolate us. And the more isolated we are, the harder it is for the people who love us to understand what we're going through. Without support, everything can become heavier. You don't just carry the pain, you're now carrying the pain alone. And that's when the secret causes it to become heavier. Now I want to get into the egg metaphor. How confidence develops is I like to think of our diagnosis and disclosure as an egg. When you first get diagnosed, the diagnosis is fragile, it's fresh, it's new, and it's breakable. It can feel like if someone even looks at it the wrong way, it could crack. Your diagnosis egg needs time, gentleness, safety, compassion, and warmth. You don't hand it to strangers and you don't toss it around. And you definitely don't give it to people who you know will drop it. You protect it. And this is normal. It took me many years of taking care of my egg before I started talking to other people about my diagnosis. And today, that egg has hatched into a bird. And through time, work, support, and connection, it has become, honestly, a soaring eagle. What used to be my biggest and greatest insecurity is now one of my strongest parts of who I am and where I feel the most confident. It's why I can advocate, it's why I speak, and it's why this podcast exists. But I'm telling you this so that you understand the eagle didn't start as an eagle, it started as an egg. And you deserve the time and space to grow your egg as well. That's why we're going to get into discernment. And who do you tell? This is one of the most common questions I get asked is, when do I tell someone about my HS? And the answer is always discernment. Now, I would suggest when you start opening up to people about your HS that you look to your friends and family and people you've already built trust with. That friend that tends to make everything about herself and doesn't have a lot of empathy might not be the best friend to pick to talk about your diagnosis egg with. Maybe the friend that would have no problem picking you up at the airport at 3 a.m. and you know that when you text her and you just need a listening ear, does what she can to be there for you, that is a better friend to pick. Now I know what you're thinking, how do I actually say it? It can feel really scary, which is why over at hsconnect.org, we actually made icebreaker videos that you can send to someone via text. But if you want to do it in person, I like something simple. You could just tell them, I have something deeply personal I'd like to share with you. I trust you. Is there a good time that we could talk? This lets the person know that it's something that is personal, that you trust them, and that you want to make sure you have time and space to talk to them about the topic. And it allows them to respond. And then when that time comes, you can just share. You don't have to sugarcoat it. You don't have to perform strength, and you don't have to hide your feelings. Good people will love you exactly as you are. And then I know you're afraid, what happens if they drop the egg? Even with discernment, life is unpredictable and people can react poorly, and that hurts. It feels like that little egg shattered. And if that little egg shatters, what happens? What next? I want you to know that you can start again. You can get a new egg and you can take time with it and you can rebuild. Eventually, with repetition and support, you will start to hatch and grow wings. We don't have to do this alone. And honestly, it's so much harder to feel like some sort of HS ogre when you have people around you who care about you. Community shrinks shame. It doesn't erase HS, but it makes living with HS less lonely. And if you're not ready yet, that's okay. You don't have to stand on the rooftop screaming your diagnosis to everyone. You don't have to post it online, and you don't have to tell your boss or your date or your neighbor. Just ask yourself, am I keeping this a secret to protect myself, or because I feel ashamed. Silence that protects can be healthy. Silence that punishes you is not. HS is a condition you have, not something you chose. You did not do anything wrong. You did not cause this. You did not fail. You are not dirty. You are not unlovable. HS is a health condition that you live with, nothing more. And there are people out there excited to support you, walk beside you, and help carry the weight. I know because I'm one of them. Thank you for allowing me to share my story. Before we close, even now, with all the advocacy I do, I still get nervous. My face still flushes when I talk about HS in person. There are still moments before I hit post where my heart races. But I also remember the first friend I told who held space for me, the first HS patient who approached me because I spoke first, the first time I realized I wasn't the only one. These moments changed my life, and I wasn't loud. I was just honest. And it started with me being honest with myself first, and then with someone else who I felt safe with. It was just one person, and over the years, I built strength. And I want you to remember, you're not your condition, and your condition is not rare. It's just rarely talked about. Thank you for listening, and I want to thank UCB again for sponsoring this episode. Lots of love, Cara.